Maternal Fetal Medicine India in collaboration with the International Society for the Study of Hypertension in Pregnancy. This is a virtual modular certification course with renowned national and international faculties on World Preeclampsia Day. With this short introduction, I'm handing over the session to Dr. Chaitra Madam. Thank you, doctors.
Namaskara. I, Dr. Chaitra, extend a warm welcome from the city of Bengaluru to all our esteemed guests present here today. It is indeed a moment of excitement, accomplishment, anticipation, and responsibility for us, the entire organizing team, as we gather here today for the virtual launch of a very prestigious project. Pregnancy and childbirth is a very cherished occasion, and we, as obstetricians, have the moral responsibility of making this journey smooth and memorable for every pregnant woman. Staying up to date with the latest developments in the field of medicine is quintessential for us to anticipate complications, prevent mishaps, and handle inevitable emergencies. Preeclampsia is a multi-system disorder. Today happens to be the World Preeclampsia Day. The mystery of preeclampsia has been unraveled by researchers and clinicians all over the world, and insights into this disease continue to evolve every single day. I welcome you all, and hence with this background, the Society of Maternal Fetal Medicine India joined hands with ISSHP, the International Society for Study of Hypertension in Pregnancy, and here stands the project PENAI, Preeclampsia Education of the Nation, India. It is an online certification module course on preeclampsia to begin shortly. Ladies and gentlemen, now let me introduce you to the pioneers of PENAI. These three clinicians whom I'm going to speak about next have envisaged the project, built up a robust team, efficiently allocated responsibilities, sincerely appreciated our efforts, and put in their heart and soul to make PENAI a fantastic educational course. These are none other than Dr. Prakash Mehta, Dr. Revati Rajan, and Dr. Sarosh Rana. So to tell you a little bit about them, Dr. Prakash Mehta, in one single sentence, is our guru in maternal fetal medicine. Dr. Revati is a persona of enthusiasm and dedication. They are the Indian co-chairs of PENAI. And of course, we have Dr. Sarosh Rana, who is the global co-chair of PENAI, the backbone of this project from the global front, who has logged in from Chicago at 4:30 a.m. US time. Thank you very much, madam. I now request Dr. Prakash Mehta to deliver the welcome address on World Preeclampsia Day and enlighten us with a brief talk on near misses in preeclampsia. I would just like to introduce Dr. Prakash Mehta in a few sentences. Dr. Prakash Mehta is well known to each of us present here. He is the Chief Division of Maternal Fetal Medicine and Head of the Department of OBGYN, Bhagwan Mahavir Jain Hospital, Bengaluru. He is a postgraduate and postgraduate fellowship teacher and examiner in maternal fetal medicine and OBGYN. He has contributed to several chapters, articles in various journals, and delivered orations in the field of maternal fetal medicine. He's the president of the Society of Maternal Fetal Medicine India. He has been the past president of BSOG, past joint secretary of FOXY, honorary secretary of ANBI. He has received the Best Teacher Award for ANBI 2019, as well as BSOG in 2020. He is also the prestigious awardee of the Lifetime Achievement Award, BSOG 2021. We're all eagerly awaiting to listen to you, sir. Over to you. I'll just stop my screen sharing, just a second. I just need 1 second.
Good afternoon, everybody. It is indeed a great pleasure to be on this program because this marks the beginning of a new era in the field of maternal fetal medicine and for preeclampsia. We have taken on our heads a training program with certification all across the country, and we are also looking at spreading across to the rest of the globe, including a very near future to rest of the Asia and at least Africa and South America, and then later on to other countries. So that has been our aim, and Dr. Sarosh Rana, who is here with us at this unearthly hour of very early morning, she has been a backbone and has been supportive to us throughout this program. And Madam, I take this opportunity to thank you very much for being with us. Now, today is the World Preeclampsia Day. Again, it gives me both pleasure and pain to commemorate the World Eclampsia Day. Pleasure because we are doing something, to ameliorate the problems in the women, at least across our country. And pain because we need to have such a day. Why should we need such a day for a disease that is so common? That means obviously we have been ignoring it and we have not been taking enough care of that preeclampsia. And that is why we need to have a special day for it. So why do we need a preeclampsia day? Now, the World Health Organization used the phrase an appalling example of neglect for preeclampsia, because this is the attention the WHO felt that is being paid by the clinical research community, the government grant agencies, the pharmaceutical industry. And remember that this significant problem affects roughly 10% of all pregnant women. And we have been rather, given it a backseat. We get enamored by HIV. We get now enamored by corona. Yes, these are also important, but then preeclampsia is something that has been killing women over ages. So, there is the Preeclampsia Foundation, which looks after this Preeclampsia Day, and its motto is to call upon the governments and health systems to recognize the importance of detecting and diagnosing risk factors and preventing and treating the hypertensive disease of pregnancy and the related non-communicable diseases. We now know that preeclampsia does not end with delivery. Chesley, the father of preeclampsia, had famously said that once the patient is delivered, everything is done. But that's not true. Most of these patients land up with terrible problems even later on in their life. And as primary care physicians for the women, the onus is on the obstetricians and gynecologists to look after these women when they have preeclampsia, advise them properly so that their future life also goes on easily. It also encourages additional research funding into preeclampsia and related disorders, prioritizes the community education in the treatment of these disorders. I'm sure all of the Indian seniors who are present here will agree that the patients do not understand when you tell them they have preeclampsia. When you tell them that you have a problem, they'll say, my grandmother or my neighboring auntie has told me that swelling is very common in pregnancy. BP will always be there. I had 10 children and had BP in 7 of them. So what happened to me? So don't get worried. I mean, this kind of fallacies are there in the society, which we definitely need to correct. We have to prioritize education, training, and access to medical resources for healthcare providers. And this is the first baby step we are taking from the Society for Maternal Fetal Medicine towards this particular goal. Address prevention through a better understanding of the causes and through access to appropriate, safe, and effective treatments. And of course, encourage collaboration and partnership between public and private sector organizations to support and advance these goals. Now, preeclampsia has been an eternal disease. 5,000 years ago, that is roughly in 3000 BC, we have reports coming from all continents. We have Atharva Veda and Sushruta from India. We have Wang Duime from China. We have the Egyptian papyrus from Africa. We have the Hippocrates, Celsus, and Galen from Europe. So from those days onwards, we know what is preeclampsia and eclampsia. 1619, Varadis first used the word eclampsia. And the eclampsia is a Greek word meaning suddenly or a flash, just like a lightning. Okay, then so on. So until 1920, when prenatal visits checked for hypertension, swelling, and proteinuria to detect preeclampsia came into vogue. Now, let me also tell you here that the human's most ancient mother ever found by the paleoanthropologists is a grave dated 28,000 years ago, where a 20-year-old woman is buried with her baby in the womb, estimated at about 8 months of gestation. So a 20-year-old girl dying with an 8-month gestation might well have been died of eclampsia. So we are talking about a disease which is not 5,000 years, but which is almost 28,000 years old. Now we know it affects up to 10% of the pregnancies worldwide, but we have papers from India which goes up to 27%, affecting the 27% of the pregnant women. And it's a leading cause of maternal death. That also we know. And the most important thing is that about 6% of the patients are affected in the postpartum period. So that means antenatally they could still be normal or near normal, but in postpartum period, they become really catastrophic. And of course, this disease has been an enigma, 2,000 years, or maybe 28,000 years, I should say, and still no answers. We still look at the crystal ball and try to decide whether everything is good or not. So we are still in that stage, and of course we are improving. But you know, at the Chicago Lying-in Hospital, the plaque is still remaining, where a person who really finds the etiology of preeclampsia, their name will be etched on it. Okay, when I was young, it was in my mind to see my name etched on it, but unfortunately, I couldn't do so much. But I hope one of our youngsters from India, their name is etched on that. Now, when preeclampsia is considered, we must remember the old medical school adage that when you hear hoof beats, most of the time it's a horse. Okay, sometimes it could be a zebra. Even in a city like Bengaluru or a city like Chicago, you may have, when you hear the hoof beats, it could still be a zebra, not necessarily a horse. Now, the implication of this is that most of the time, a preeclampsia behaves quite well, quite all right, no problem at all. And then suddenly one day you have a patient who gives you a lot of problems. So our aim is to catch hold of these zebras and make sure that we stick to the horses and not to zebras. There's one more of the downside, you know, preeclampsia, we all know, is the disease of theories. And one of the downside of the disease of theories is that clinical diagnosis and care can be confusing, inconsistent, and inadequate. And this results in the death or disability for hundreds of mothers and thousands of viable babies. So this program with this PEN-I and with this Preeclampsia Day, we are hoping that at least we'll make a small dent in these large numbers who are dying due to this disease. Now, we also know that the uninformed patients don't know what warrants provide intervention. And there is a poor communication model between the doctor-patient relationship, where communication is typically non-existent, extremely limited, and worse yet, a patronizing kind of approach. And healthcare providers are overly concerned with caring of the patients, because they're scared that if you tell the patient that you have got a serious problem, they may leave them and go away to another doctor. But we should remember that being scared never killed or maimed a woman or her unborn baby. So let us not shy away from our duties when it is required. This is a multi-system disorder with origin in early pregnancy. Although the clinical manifestations occur late in the pregnancy, the pathogenesis begins early in the pregnancy. And of course, as I told you, it is associated with adverse maternal and neonatal outcomes. As things stand today, it's an predictable disorder, with the definitive cure being termination of the pregnancy, irrespective of the period of gestation. Now, this painting is of M.F. Hussain. It shows a huge herd of elephants marauding a woman. And this is exactly what happens when a woman gets preeclampsia. So that's why I thought this M.F. Hussain would be an apt painting to show today, because just as the elephant attacks everybody, the same way this woman is attacked when she gets preeclampsia. So with this, we go to the second part, that is avoiding a near miss. I'll just quickly give you an example of a case and how we managed it, so we understand that what is near miss and how a near miss is avoided in preeclampsia. Now, one thing is for sure, many maternal deaths or near misses are associated with substandard care. That means as OBGYNs, we need to upgrade ourselves to ensure that no substandard care is given to any of our patients. The triad of hypothermia, coagulopathy, and metabolic acidosis is what causes most of the problem, which results in a decreased myocardial infarction and also causes coagulopathy, which causes most of the problems in a preeclampsia. And one word we need to keep in mind is individualized. Guidelines are there, protocols are there, we need to use them, definitely yes. But at the same time, since this disease is quixotic, it behaves in a very quirky way, we need to individualize the patients to identify what is going wrong with this particular patient. Now, this to begin with is a story of a 20-year-old primigravida gravida with history of amenorrhea 30 weeks, regular ANC. She was referred to me with a history of pain, abdomen, and vomiting. And on admission, her blood pressure was 180 by 140 millimeters of mercury, and the urine albumin was 4+. In the investigations, the packed cell volume, the hematocrit was 40.5, the platelet counts were 30,000, and the liver enzymes were in the sky, 3450 and 4250. Although we say generally in preeclampsia, the liver enzymes don't cross in hundreds, they don't touch thousands, but there are exceptions, and it could touch in thousands. The bilirubin was quite high, the creatinine high, uric acid high. So we stabilized her, gave her magnesium sulfate, and did a C-section on her, and a live male baby of 980 grams was delivered, which ultimately did well. The PPH was there, of course, but that could be controlled. Now, post-delivery, in spite of all measures, 1 hour later, she threw convulsions. There was a distension of abdomen, there was hematuria, and the hemoglobin dropped to 6 grams per cent. So with this, as you can see in this X-ray, the patient developed pulmonary edema, and she had to be put on a mechanical ventilation. And this is her ABG showing that there was already a metabolic acidosis. Very soon, the patient became drowsy, irritable, with decreased motor power in the right upper and lower limbs. My worry at that particular stage was whether she has bled into the brain. We immediately did a CT, and we found that no, it was not a bleed, but it was edema, especially in the posterior part of the brain, giving us a diagnosis of the posterior reversible encephalopathy syndrome. Now, this slide just shows the trending of all our investigations, and is important to know that in preeclampsia, it is not just one set of investigation that is important, but we need to keep on trending and see how the trend behaves, improving, not improving, improving very well, and so on. Now, this patient, because she went into renal failure also, we had no choice at that particular time. We did a plasma pheresis on her first, and then later on, because of continuing anuria, she needed a dialysis. She showed us some symptomatic improvement. 3 days later, the bilirubin decreased, but however, the renal failure still persisted. At the end of 2nd week, the urine output improved, and at the end of 3rd week, she had normal renal function. And mother was discharged after 3 weeks, and this is the happy mother. Both mother and baby got discharged, and this is just to show the color of the urine. You can see from the dark red how it has slowly cleared up over a period of time. So these are some of the things that we need to keep in mind, and the way forward to avoid this kind of near misses would be to monitor the critically ill mother properly. So we need non-invasive monitoring. We need maybe inotropes if there is any problem. We need nutrition. Ensure that the nutrition is quite all right. The pain management and epidurals wherever it is feasible. A fluid balance, which is of most importance, and electrolyte correction. The wound surgical drain correction, the transfusion, and hypertensives and antihypertensives and anticonvulsants. And finally, she may even require an invasive monitoring, either a CVP, arterial line, and so on. Now, the investigation should monitor for the target organ, her cardiorespiratory status, her electrolytes, her ABG, renal function, of course, the hemogram, coagulation profile, fibrinogen, D-dimers, sepsis workup, autoimmune workup. Whenever there's an early preeclampsia, we need to rule out a background autoimmune disease. And important thing that we need to remember is that altered physiology in pregnancy makes interpretation very difficult. Okay, we also need to make sure the ABG and fundoscopy is equally important. And of course, the urine detail, what is microscopic hematuria, the macroscopic hematuria, we need to look at everything. APH and PPH go hand in hand with preeclampsia. So whenever you have a preeclampsia case, please watch out for antepartum hemorrhage. The intrapartum, if you're doing a surgery, you can see the amount of bleeding that is occurring during a C-section, and also the postpartum hemorrhage is also very common. So we need to look for all this and treat it on time. Now, fluid monitoring is very, very important. Quite often in a patient with severe preeclampsia, we find at the end of surgery or the delivery, the urine output is only like this, about 10 ml or 20 ml the last 1 hour. So we need to really balance that. We need to decide whether to keep the patient dry, wet, or just right. Because the balance is between hypovolemia and hypervolemia. Injudicious fluid management is a contributor to maternal death. And determining the intravascular volume is difficult and not something that we as obstetricians ever do well. And also we need never to forget is that the iatrogenic fluid overload is the main cause, and fluid responsiveness has to be tested in these patients. And if we could do a simple test like an IVC ultrasound, we should be able to make out whether we need to give in more fluid or less fluid. All these are controversial, but then these are the something best that we have in our hands right now. And the most important thing is take your decision after synthesizing the entire clinical picture. Don't go by one test or don't even go by 2 tests. You need the entire constellation to decide what we need to do for this patient. Early detection, of course, is critical, no doubt about it. And we have other problems that the accurate determination of blood pressure is difficult. The evaluation of maternal organ dysfunction is subjective. And assessment of FGR requires facilities which may not be available. If on a Saturday night, we need a Doppler or an ultrasound scan, in most of the centers in India, this may not be feasible. So we need to really see how we can overcome that. And non-proteinuric PE, it has been drilled into our head since the postgraduate days that preeclampsia is hypertension, edema, proteinuria. So to understand that there is a non-proteinuric preeclampsia, which is very dangerous, is especially challenging. And one of the factors that we're going to take in this course is to ensure that people understand that non-proteinuric and even non-hypertensive preeclampsia can exist and it can be very dangerous. Now, we know that some dangers are nicely seen, like this tiger coming in. We know that it is danger, but you look at the next one, you can see a lizard lying hidden among the buds and the flowers. And that is very difficult to identify. The same thing happens with preeclampsia. You have so many people. How do I know who are the red women who is going to give us the problems amongst all these groups? So we need certain good tests for that. And risk stratification is a necessary prerequisite for risk reduction. Now, whenever we talk of risk stratification, we need to balance between the feasibility and the cost. Because in a third world country, cost is very, very important. We don't have an NHS giving money for all our patients. The patient has to pay from the pocket. So we need to balance between the feasibility and the cost. And there are 2 very common tests. I'm not going to go into details of it. One is the S-split PLGF ratio. And the second one is a point of care test, which is a glycosylated fibronectin. Okay, we also need to differentiate between early onset preeclampsia, which occurs before 34 weeks, and the late onset preeclampsia, which occurs after 34 weeks. Both behave differently. Most of our screening tests identify only the early onset preeclampsia, while majority of us in the practice are going to deal mainly with late onset preeclampsia. So in a tertiary care center, you may be seeing early onset preeclampsia, but by and large, the population outside will be seeing the late onset preeclampsias, for which the screening test or the prognostication test are not going to be very good. And of course, we need to have a proper delivery plan for these patients. Yes, we need to improve our transport facilities. India has moved quite a bit from the days when I've seen the days when the patients would be brought in bullock cart to the hospital. I've been a personal witness to it. And I'm sure in some of the areas in India still that could be happening. From there, now we have moved on to the air ambulances. Most of our modern hospitals, especially in metro cities, come with a helicopter helipad on the terrace so that the patient can be transferred very easily. We are improving, but we need to definitely improve some more. One very important thing to avoid any mishap is the role of training and drills. Now, look at this. When you have people playing soccer, there is absolutely anarchy there. But look at the symphony. When you have a symphony, everybody is so balanced and each one doing their own work. So we need drills to identify that whenever suddenly a problem comes in, we should be able to do the work properly. Of course, continued research and evolving protocols are important. So in conclusion, both maternal and fetal life is at risk. Multiple issues are involved. You need a good balancing act to manage these patients. Aggressive management is the key. Don't take a laid back attitude for any preeclamptic patient. Have eclampsia drills and use magnesium sulfate as standard protocol. There should be no hesitation in using magnesium sulfate, even in the smallest of the small centers. Steroids have to be given for lung maturity in these patients. Early transfer is important. Please do not hold on to the patient if you don't have facilities. A multidisciplinary approach is also important. Beware of atypical presentation. And remember that we need to give this patient a continued care for life, not just till delivery, but for life. So thank you very much for a patient hearing. And this is one of the carvings from our Hoysala temple, which is in Karnataka. Which shows the act of delivery. This is almost a 1,500-year-old temple. The carving is 1,500 old, and it shows how one person is thinking. You can see she's thinking what to do next, and these two are supporting the woman to deliver. Now, with a good care that we could give to the patient, preeclampsia will not remain a problem anymore. And finally, help our country and later on the whole world also in whatever small way we can. I already told you, we are just taking baby steps in it. We are not claiming anything big, but we presume that even if we save one mother due to our program, it would be worth it. And this program is basically working together to save lives. I'm very happy to say that when I asked for faculty from all over India and across the world, no one said even once no to me. We have Dr. Chamila, we have Dr. Shaswati, we have Dr. Jyotsna Suri, we have Dr. Alpesh Gandhi, Dr. Sanjay Gupte, Dr. Suchitra Pandit, Dr. Tarkeshwari. So we have all the people across from the world, and of course, we small fries from Bengaluru are also going to take part in it. And the international faculty, we have Dr. Sarosh Rana. I already pointed repeatedly that she's the backbone of this program. We have Dr. Leona Poon, we have Dr. Laura Maggie, and we have Dr. Michael Gravett. So that we get an entire perspective of old, new, recent, past, everything put together. And this virtual collaborative modular certification pilot course, we are calling it as a pilot course because our aim is to touch 500 gynecologists in the country. And if we touch those 500, we will be emboldened to spread this program across the globe. And we are hoping that we will make some difference with the help of all of you, with the help of this wonderful faculty that we have managed to assemble with us, a small difference for the maternal morbidity and mortality. Thank you very much for the patient listening.
Ladies and gentlemen, the virtual launch of Penile is just a few minutes away. I request our co-chairs and esteemed guests to light the lamp of knowledge and dispel all the darkness. May Lord Saraswati constantly shower her blessings on Team Penile.
Saraswati namostute Sharade Vidyavrade 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 Saraswati Namostute शारदे विद्याप्रदे सरस्वती
The most awaited moment has come. I now request Dr. Prakash Mehta to do the honors of officially launching Project Penai, Preeclampsia Education of the Nation, India, and its brochure.
Thank you all. And the prayers were rendered by Abrameya, son of Dr. Revati Rajan. I'm sure he had a wonderful melodious voice, and we hope to hear more and more from him in future. Over to you, Dr. Revati.
Thank you, sir.
Just one more minute. Before Revati takes over, I have to thank the family members of every of our members, because most of our team members have been working very hard, trying to put things together. Our concept builders, who are all youngsters with a lot of enthusiasm, have really been very active. And I've been a bad taskmaster, I should say, calling them at short notices, calling them for late night meetings, calling them at odd hours, and their family has put up with all this. And I take this opportunity to thank each of the concept builders and their families for making this program a reality.
Thank you, sir. Thank you, Team Penai. And now we would like to have a few words of wisdom from Dr. Sarosh Rana from Chicago. Dr. Sarosh Rana, this is just a very brief introduction of hers. She's the section chief of Maternal Fetal Medicine, professor of obstetrics and gynecology, the University of Chicago, USA. She is the co-chair of the Global Health Committee at ISSHP, and she is our international advisor, the advisor for the SMFMI. Over to you, madam. Thank you.
Thank you very much. And it's just a pleasure. I was looking at how many people, we have 171 participants, so that's phenomenal and fantastic. So obviously I want to thank Professor Prakash Mehta for organizing this fantastic course, but also obviously organizing the day today. It's just very seamless and beautiful. And then Revati, and I just want to give a personal anecdote here. So I think I met Revati, I think it was like 2015 or 2014 through a meeting that we were both attending. I forgot where it was. It was in Germany or Sweden. It was someplace. And Revati just approached me, and that was like several years ago, and just introduced herself and said, oh, I work in Bangalore, and can we collaborate? And then from the small meeting, I remember sitting across a table, and we were just like talking a little bit about what kind of studies do I do and what would she want to do. Then she invited me to Bangalore. We started the fellowship. Then she obviously did the studies, and then she presented, and now we are here developing this course. So I think it's just like, for me personally, I feel like, yeah, I mean, things do happen. If you actually put one step in front of the other, you'll definitely get somewhere where you want to be. So thank you so much, Revati, for putting, I know you're a very passionate person and you put a lot of heart and effort into this. So this is fantastic. My own personal story, I'm actually from India. So I'm from Northern India. I did my education in Aligarh. And one of the reasons I even got involved in preeclampsia is because that's all, like Dr. Mehta was saying, I would see patients, not so much in bullock carts, but definitely it's a very poor community up there in Uttar Pradesh. And one of the memories I had when I was training there was that every day we would just, that's all I saw is eclampsia and women, like, and a lot of, obviously, a lot of maternal mortality. So one of the things that stuck to me even when I came to US was that obviously we have to do something better than what we are traditionally doing in terms of management of the patients, but more importantly, in terms of even how we approach them for diagnosis, for prognosis. So if you don't mind, I want to just share some slides just to give a preview to people for this course. So thank you so much. And again, the whole PENI course started by simple steps. I mean, Revati emailed me, and even, I mean, I think even the name PENI, we just came over the email. I'm like, yeah, we just call it PENI, Preeclampsia Education of Nation. So I wanted to keep it broad because I agree with that. We start with India, and if it's successful, and I'm hoping a lot of our physicians joins and providers will join through these lectures to understand, you know, all these similar to what Dr. Mehta was saying, these complicated cases, but also like systematically understand what the disease is, how we manage it, where we are in terms of, you know, modern medicine and biomarkers, what are the long-term effects. I'm hoping that people will join our sessions and modules and obviously be there for the live sessions that we will have. And I understand, I agree, if it's successful, then I think there's definitely a need to take it to other countries as well. So I'm now going to share my slides. Please don't mind my messy desktop here. All right, so that's a little bit of my introduction. So I am, and again, like 3 years ago, when I became the global co-chair for ISSHP, one of the things that Dr. Laura McGee, who's a fantastic person, and she's the chair of ISSHP, kind of mentioned that we should actually start something. And one of the things that came up was, and as a person, I feel like education is something that we can all give. So we can give education to each other. We can give education to people, our residents, our fellows, train people. And then I'm a big proponent of patient education as well. So I think, again, this is a testament to say that, you know, you can obviously bring group of people together, simple, you know, who are have the same kind of mindset and actually, you know, bring programs like this together. So I definitely want to thank, again, Dr. Mehta and Dr. Revati Rajan for constantly working on this. And it's a beautiful program. So I'm just going to not kind of talk too much about the definitions and things like that. This is just, I just put some 10 slides together just to kind of give people, maybe get some interest into the program. Like Dr. Mehta was saying, it's a common problem in pregnancy, and I agree, and we'll talk about it, that we need to get away from proteinuria. There is lots of hypertensive morbidity and mortality that is happening without proteinuria globally. And I've done some work in Haiti, and I was just recently in another conference, and I brought up the PENI course, and people were actually saying, oh, we should have this in Africa because they are facing pretty similarly high morbidity and mortality from the disease. So worldwide, about 70,000 women are dying every year from preeclampsia, and a massive number of fetal and neonatal deaths. And like Dr. Mehta was talking about the lady, a lot of deaths are actually occurring from seizures and bleeding. In the United States, at least I can tell you, and I have some data on kind of a state specific, but a lot of prematurity is actually related to preeclampsia, eclampsia. So that's a major, massive problem here. And I'm sure that's there in India as well, is prematurity related to hypertensive disorders. And again, one of the things that we will talk more in the courses is that preeclampsia can present very atypically. So the patient that Dr. Mehta was presenting, I thought she had HUS or TTP because she was just, she was, I thought she had some sort of a hemolytic disease, but turns out, no, she actually had eclampsia later on. So I think definitely role of some biomarkers in terms of figuring out what's going on. And as we stand here, unfortunately, I know we don't have any treatment, but I think with proper prenatal care and just the very extensive management plan like Dr. Mehta was presenting, could be, at least now, could be the way to go forward in terms of managing these patients. And there is a lecture that I'm giving about long-term cardiac complications. So this is one of the things that are a little bit actually not talked about very frequently. And I have data, and we did studies here, even in the US, showing that a lot of our cardiologists and medicine colleagues don't really recognize that preeclampsia is a massive risk factor for long-term cardiovascular disease, such as, MI and stroke. So the way that I kind of approach this whole issue of preeclampsia is like, I have a pretty, and this is a slide that I borrowed from Dr. Laura McGee. this is kind of a holistic approach to pregnancy research. And I see that a lot of obviously participants are here, and you guys are professors and hold major academic titles and prestigious positions. So the way that you look at preeclampsia is not just like in the lab or biomarkers. I look at it as a very, very diverse thing that you can do. So for example, even access and health system is a field of research that you can work on. Like, how do you provide appropriate access to high quality care? Involvement of community, obviously advocacy is like, what we are doing right now is not so much advocacy, but advocacy would be you go to your local government and say every woman should have access to high quality OB care. Obviously, there are lots of studies going on in terms of pre-existing conditions, such as women who have chronic hypertension. There's a massive role of diet and nutrition as it applies to any pregnancy complications, but definitely preeclampsia. I live in this box down here in the box of biomarkers. So I've been for the past 15 years with various different groups nationally and internationally, have been trying to figure out how we can actually develop some tests which are a little bit more sensitive and specific compared to what we are using currently. So there's just like as a kind of prelude to people to think, to say how, if you want to get involved in any kind of pregnancy research or preeclampsia research, there's so many different avenues that you can actually involve and take care of your patients and actually improve their life. So a little lecture here about what is preeclampsia. It's a pretty complicated disease, and I think that's why we are stuck here in this scenario of not being able to diagnose it, and mothers are still dying. And again, I'm not going to go into much detail here, but just to show you guys as to what will be provided in the lectures, is essentially it's a placental disease. And what we've been trying to figure out is it's two stages. So you have abnormal placentation, but it's really the maternal syndrome that we'll be talking about mostly in at least in my lectures. And this is what the patients are facing. So the diseased placenta is releasing a lot of these abnormal factors, which in my mind are the ones that are causing all this dysfunction downstream in terms of on your endothelium, leading to hypertension, leading to visual disturbances, seizures, health syndrome. So again, one thing that I wanted to kind of bring everybody, and I know Dr. Mehta just mentioned briefly about the biomarkers such as soluble FLT and PLGF. So these are now, and Revati is going to present her studies in our modules as well, but they are available in India. So I was involved in one of the earlier studies looking at the biomarkers in terms of how we can use them in preeclampsia. But essentially for everybody to know that there are tests now that we can do. For example, this protein, which is called soluble FLT1, is high in women who have preeclampsia, and PLGF is low. And there are several studies and some in clinical practice as well, and real world data that you can actually use these tests in your clinical practice to stratify patients who are at risk for adverse outcomes. So one of the studies that I'm just going to mention here again, just as a prelude to people to get interested in our modules, and we have several modules regarding all these biomarkers, is that they can be used to assess a risk of adverse outcomes among women. These biomarkers have been shown to inversely correlate, so they can actually give you a sense of timing of delivery, how far you can take the pregnancy, and if you can, what is the risk of pregnancy in terms of prematurity. And then I've done studies to show that they can be warning signs. So, sometimes when you see these patients and they're admitted to your hospital and you're like, oh, I know she's got hypertension and some amount of maybe protein, maybe not. What is her absolute risk that she's going to suffer some peripartum complication? So we've done studies of angiogenic factors actually even among admitted patients and patients who have hypertension, and shown that these biomarkers are very abnormal in patients who have, even after the diagnosis of preeclampsia. So I think in summary, again, we're going to talk about this more, but these biomarkers can actually be used really for risk stratification of patients for severe peripartum complications, which you would think that I think as a clinician, I would find it to be very, very helpful in your clinical practice. So just in terms of, again, this is just a prelude to people, and obviously people can go and read up more about it, but there are several studies that soluble FLT1 definitely increases prior to preeclampsia symptoms. They're very, very elegant studies looking at rule of these biomarkers as a rule out test. So you can actually rule out severe disease if the biomarker levels are normal. And we have done studies looking at biomarkers as a rule in test, when you can actually use the biomarkers to stratify and to figure out which is this patient who's actually gonna get sick. And just for everybody to know, the current standard of care, which is use of hypertension for prediction of adverse outcomes, gives a positive predictive value of just over 20%. So very, very poor positive predictive value. And obviously, we have done studies showing that the positive predictive value for ruling in, for example, adverse outcome of preeclampsia is of the magnitude of 60 to 70% with these biomarkers, and a very high negative predictive value, almost of 100% if you use them. So obviously, we're going to talk more, but please join our modules because we'll talk more in detail about these studies. And I know we're going to present some of the clinical scenarios of how perhaps you can use these biomarkers in your clinical practice. One other thing that I just want to leave you guys with this thought is that the way that I feel that the way the field needs to move forward is that what we're doing conventionally, all the physicians, all of us across the world, we are in this box here on the left side. We have this conventional approach to all our patients when we are evaluating them during their pregnancy. So we see them every 4 weeks in the beginning, then we start seeing them every 2 weeks, then we see them every 1 week. And the whole idea is that you're trying to find patients who are going to develop preeclampsia, right? So there is really nothing else going on in the third trimester, I feel, in my mind. Once you screen for your GDM, you're really trying to figure out who's going to have an IUFT, who's going to develop preeclampsia. So the methods that we are using in US and everywhere else are pretty resource intense. I mean, all of us are constantly in our clinics. These things, by the way, the one that we are using, the blood pressure and protein, over and over again, they have been shown to have less sensitivity, very low sensitivity and specificity. So they have a very poor positive and negative predictive value. So it's hard to say who's the one who's going to develop the disease. The thing that I'm hoping that through these, not so much today, but through these lectures, I'm hoping that we can move our thinking to the green box here. So what we need to do, we need to do some sort of a risk stratification throughout pregnancy. So you need to maybe stratify them in the first trimester. I know we're going to talk about that. We're going to either use biomarkers or peers or other models to stratify them throughout pregnancy and really divide our patients into high risk and low risk. And trust me, majority of our patients are low risk. So the prevalence of preeclampsia is still 6 to 10%. So those 90 out of 100 people are not going to develop preeclampsia. And that's the whole idea, is get them out of the system. They can deliver with midwives. They can deliver with low risk doctors. But we can focus on these high-risk patients who need to be transferred to a higher care facility, like, you know, like Dr. Mehta was talking about, transfer them out. So I feel like there has to be some sort of, and in my mind, that's what needs to happen, and that will lead to reduction of your maternal and fetal morbidity and mortality. Is this risk stratification, identification of patients who are at high risk, and moving them forward to healthcare facilities where patients can actually be referred to and taken care of by physicians who have knowledge of the disease. So I'm not gonna, again, too much into here. I don't know what time it is, but don't think it's just the problem of India. This is a massive problem in the United States. In fact, CDC just came back in 2019. And I'm going to talk to you guys about postpartum, but don't forget the postpartum period. In fact, majority of your maternal deaths are happening in postpartum. So only in the US, only 30% of the deaths occur during pregnancy, while majority of the deaths are actually occurring postpartum. And it's this period of postpartum, delivery within 1 week, and then delivery within 1 week to post-delivery within 1 week to 4 years. And this is a map of United States. Look at that, the darker the color, the more mothers are dying. And it's a massive problem in Black women. So I know we don't talk about it on modules, but I'm happy to answer questions or at least get you guys' attention that there are a subgroup of patients who are at significant risk to have adverse outcomes. And one thing I want to leave you here is this slide, is that what we need to do, like Dr. Mehta was saying, we need to have a very team approach to this. So you as leaders, and hopefully people who are listening here, we have to gather all our resources, our nurses, our other healthcare providers, your ASHA workers, your midwives, and you need to, at least for the management of hypertension, have to have a very structured protocols for management of your blood pressures. You need to timely treat your severe hypertension. You need to improve your rates of postpartum follow-up. I don't know what the rates are in India, but in our institution, the rates were only 30%. And with this program that we're calling STAMP Hypertension, this is one of the pictures I'm teaching all the nurses. So I do these open tables where I just sit there with my blood pressure monitor and with my protocols, and I just invite anybody to come and ask me questions. So I think it's organizing your hospitals and organizing your health systems around your patient conditions improving obviously your long-term blood pressure control and follow up with specialists such as the cardiologist is the way forward. So I want to again thank Dr. Mehra and thanks Revati and thanks all the organizers and all you lovely people listening in. That's my family here. That's my daughter. She's going to college. She's my little one. She's gonna be, she's in 9th grade. That's my husband. He works at University of Chicago as well. And again, I think I'm blessed, but thank you very much. And thanks for obviously advancing knowledge about this disease. It's fantastic. Thank you very much for inviting me.
Thank you, Professor Rana. All the delegates are eagerly awaiting to interact with you during the live sessions of the course. I now request Dr. Revati Rajan to take us through the making of PENAI and the course specifics. To introduce Dr. Revati to those of you who don't know her, she is the Chief Consultant, Maternal and Fetal Medicine and Managing Director of Mirror Health, Bangalore. She is also the Visiting Consultant at Milan, Bangalore, and she is the Associate Consultant to Dr. Prakash Mehta at Mahavir Jain Hospital. She is currently the Secretary of the Society of Maternal Fetal Medicine, India. She is the Executive Editor of the Pan-Asian Journal of Obstetrics and Gynecology. She was elected as the Executive Committee member of BSOG, and she has been the Organizing Secretary of Life Conference 2019 in Bangalore. She is affiliated to several bodies, and she is the founder member of Gestosis India chapter. To speak to you about her awards, the Yuva Foxy Award, South Zone, the Certificate of Excellence in the categories of Research and Young Scientist at the 2nd Academic Brand Awards, New Delhi 2017. She has several publications to her credit, and I would like her to elaborate on them that would add more meaning to the work that she has done. She has special interests, of course, in the field of hypertensive disorders of pregnancy, and she's currently pursuing research with Maternal Fetal Medicine Unit, Chicago. She's also been keenly interested in utero fetal programming. Over to you, Dr. Revati.
Thank you so much, Chaitra, for that elaborate introduction. And I want to welcome all the faculty, all the esteemed delegates, and everyone here, because our talks, have been specially tailor-made for this World Preeclampsia Day. And I'm going to tell you something that went on for the making of PENAI. So I'm trying to share my screen. Well, the making of the preeclampsia education of the nation, India. Every day battered, and it all started about 9 months ago. So it's time to deliver. Now, what is preeclampsia education of the nation, India? It's a certification course for practicing obstetricians and gynecologists in India, using teaching modules with the latest updates on hypertensive disorders in pregnancy with special emphasis to preeclampsia. And most importantly, it's a collaborative project by the Society for Maternal Fetal Medicine India and the International Society for the Study of Hypertension in Pregnancy, the global body. So to summarize, it's about working together to save lives. Now, this making is with respect to the faculty and what went on in making the course. And later I'll be talking the brochure with specific emphasis to what is it for delegates. So why PENAI? Why did we think of PENAI? Like how Dr. Sarosh Rana just shared, it was an email in August when we had this idea that we had to do something like about education and empowerment. So it was Dr. Prakash Mehta and I with Dr. Sarosh Rana, and we were just discussing all this on emails. And why we thought about doing this is because there was no clarity about guidelines, classification systems, management protocols for hypertensive disorders in pregnancy in, with particular emphasis to preeclampsia. There's several queries regarding atypical presentations of preeclampsia because this can contribute to clinical dilemma. There are challenges which exist in extrapolating global guidelines to the indigenous population. And there was a felt need to source and compile clinical research protocols which was relevant to the Indian practice. And most importantly, there are many implementational issues in urban and rural settings. So what did we thought it was only through education and empowerment, and that's how this idea of PENAI came in. Now, when PENAI? The conception of the idea started in August 2020 over emails. The progress, then we established collaborations. Obviously, we linked the two societies together, the Society for Maternal Fetal Medicine India, from where myself and Dr. Prakash Mehta belong to, and the ISSHP, for which Dr. Sarosh Rana is the global chair for the Global Health Committee. And sourcing educational grant, we had to find out how we were going to, probably source a grant. So we had Roche Diagnostics India Private Limited, who helped us for the pilot project. We had to structure project specifics. We did all this with emails, liaising with clinicians from across the country, because we wanted everyone who was eminent in the field of hypertensive disorders from across the country. India is a huge country. We wanted everyone to be participating in it. We wanted to identify our supports. We recruited staff from the SMF My office. We liaised with a team which could help us, that is Medinet, for content compilation, recording, and hosting, and working on course propagation strategies, which we're still doing, which is through brochures, teasers, etc., with social media, email, and WhatsApp. The online launch is today, and that is on the 22nd May 2021, on the World Preeclampsia Day, something so very, very close to our hearts. And commencement of the registration will start mostly in June 2021, and this registration will be coordinated by Medinet, and very nominal commitment fees. Now, to just tell you about the organizers, we have the Society for Maternal Fetal Medicine, lies with the International Society for Study of Hypertension. The Indian co-chairs are Dr. Prakash Mehta, who's the president of the Society for Maternal Fetal Medicine India, who's the chief of Department of Maternal Fetal Medicine, Bhagwan Mahavir Jain Hospital, Bengaluru. And I'm also one of the Indian co-chairs. I'm the secretary for the Society for Maternal Fetal Medicine India, and I work as the chief consultant and managing director at Mirror Health, Bengaluru. And of course, we have Dr. Sarosh Rana, who is the section chief of maternal fetal medicine from the University of Chicago. And she is the co-chair of the Global Health Committee at the ISSHP and international advisor for the SMFMI. Our supports, yes, it was Roche India who gave us the financial grant for the pilot. Then, of course, the office staff who worked every day, every minute, every second. We wholeheartedly thank Mr. Shrikant and Raj Gopal for the IT support rendered. In fact, the inauguration, the virtual inauguration, and all the the IT supports were rendered by them. Then we also had Dr. Meghana Srinath, who worked for the concept. So she was the concept coordinator. And we also thank Medinet, who was part of the knowledge and hosting, partner with us, and they supported for content recording, hosting, registrations, and course propagation. So this is briefly about the PENAI project and how we went about it. Now, the question in the mind, why pilot? Mainly because we wanted to concentrate on a small group of registrants. I mean, we wanted to look at a group of, say, about 200, so that we could make the certification process easier at the beginning. We wanted to gather feedback from all the delegates and the faculty to help make the course more relevant with reproducible information. And we wanted to add value to the project beyond the pilot with insights procured during the pilot implementation, because we were very sure that there would be a lot of suggestions which could help us to move forward effectively. The pilot encompasses 4 courses with 6 modules. So we have limited registrations, each including the assessment. Each course can register up to 50 delegates initially and should include at least 10 delegates to start with. How did we do all this? We had something called the PENAI project implementation meetings, all virtual. They were brainstorming sessions with the concept builders and the Indian co-chairs. And the final versions of all this used to be discussed with the global co-chair on the emails. We're still in the process of putting all this together. We've had about 9 PPI meetings, and they were held for extensive discussion of project execution and content formulation with the PENAI core team and the concept builders. We also had peer review of the content based on guidelines and evidence-based information. And this was for content finalization. And this has initially been facilitated by 4 one-to-one review meetings, and we still have more scheduled. Then the SMFI office, what did the office do? They coordinated the meetings with the faculty, with the delegates, with people, with the co-chairs, collation of the MOUs, the documents. There was a lot of paperwork. Office also helped in content structuring, brochure designing, the emblem. We also did the emblem ourselves, the plagiarism checks, the creation of the PENI helpline. We created a helpline where it could cater to inquiries regarding the project from the faculty and the delegates. And of course, they were part of the collaborative efforts, linking delegates and course faculty through email and WhatsApp across the country and the globe. Now, how did we design the modules? Most importantly, we wanted to have a comprehensive end-to-end collaborative evidence-based course. And all the content was to be reviewed by the co-chairs, both Indian and global, at every stage. So we started with the definitions, the classifications, the management dilemmas, and of course, we have a dedicated panel where we are talking about implementation issues, how to put in the protocols, how to actually deal with the situation, and also evidence-based protocols for comprehensive learning and understanding. And we wanted to do it in such a way that it is very clinician friendly. And we wanted to have collaborative efforts because we wanted contributions from across the country, but also we wanted the global contributions as well to fine tune our content. So what are the milestones that have been achieved this far? We first identified the faculty, the support, the staff. We built a team of speakers and concept builders, compilation of the coursework, which was prepared by the concept builders, including plagiarism checks. And then finally, we are recording and finally we're compiling all the talks ready to be hosted by Medinet, mostly in June. Now, we also have had some strategies to reach out to delegates with social media propagation on Facebook, YouTube, and WhatsApp. We want to reach out to as many practicing clinicians. We are aware that there are about 40,000 clinicians across the country who practice obstetrics and gynecology. We want to reach out to each one of them. We want to be a part of empowerment so that they can save many lives. So we've had teasers which have been contributed by KOLs like Dr. Kamini Rao, Dr. Hema Divakar, who've been past presidents of FOXY, and Dr. B.S. Ramamurthy, who's been the chief patron of MUSC, as well as the co-chairs. And we believe that the inspiring words of these KOLs will inspire the delegates to be a part of this course. We've been doing a lot of word of mouth propagation. We've been we plan to have many targeted briefings in medical colleges, private hospitals, private practitioners, focused webinars. We want to reach out to every clinician out there in any institution. We've also started the website propagation. It's on the Medinet, the SMFI, as well as we're also happy that it's on the ISSHP as part of the Global Health Committee. So what is the future of our course? It is to navigate beyond the pilot, to reach out to all the practicing clinicians across the country and beyond through collaborations, like how Dr. Prakash Mehta as well as Dr. Sarojana has emphasized till now. Periodic module updates, that is very important. So we want to do that to make the course more relevant and robust. We want to empower clinicians with the latest evidence-based guidelines and research on preeclampsia who can contribute to reduction in maternal and perinatal morbidity and mortality due to the disease. We want to reach out to global organizations for extended support. We want to support preeclampsia research in the future, which will enhance quality of care in the country. So in a nutshell, we want to join hands. We all want you to join hands with us, and we all save lives. Thank you so much. So before I sign off from this, I also have to tell you about the brochure. I want to put in this from Chanakya Niti. So it says, Prabhutam karyam alpam va yannaraha kartum ichati. Sarvarambena tatkaryam simhadekam prachakshate. That means it says, give total focus and full effort. Focus and effort for all tasks. There's nothing called major or minor. All tasks are important. Like that shown by a lion is needed to pursue any endeavor which will lead to success. And that's what we want to do. Thank you. Should I continue with the brochure, Chaitra?
Yeah, please, Dr. Devti, you can take us through the brochure, which is just being launched. Thank you.
Just a minute, just give me a second, please.
Put it in a nutshell,
Yeah.
that was indeed how all of us worked, and PENI today is a reality. Over to you, Dr. Revki.
Yeah, just give me a second. Yeah, is it seeing? Yeah, I think it's sharing. Yeah. Well, that was about the making of PenI and how the faculty got together to make this project. And now this is what we have for the delegates. Well, this is about the preeclampsia education of the nation. I've already told you about this project with the co-chairs. So the course objectives was preeclampsia is one among the three leading causes of maternal morbidity and mortality, next only to hemorrhage and infections. The incidence of preeclampsia varies between 10 to 30% across India. Atypical manifestations are very common. This project aims to upgrade the clinicians with the latest guidelines and evidence-based practices related to preeclampsia through certification, which could empower them to manage the disease more appropriately, contribute to reduction in adverse outcomes. Now, what is this course for delegates? It's a collaborative, comprehensive, educational certification module course on hypertensive disorders in pregnancy. We are covering the entire gamut of hypertensive disorders with special emphasis on preeclampsia. When we have already launched it in May, we are proposing to register in June. Why for delegates? Because we have credible accreditations from two societies, the Society for Maternal Fetal Medicine India from the Indian perspective and the ISSHP from the global perspective. So we have current updates, evidence-based practice, renowned faculty, nominal fee. It's about 4,500 rupees with GST. Module-based online audio-visual course. So we have about 6 modules, out of which 5 are learning modules and 1 is an assessment module, and all of them are online audio-visual. Pre-recorded clinical panel highlighting management dilemmas, very, very important. We are actually going to talk about real-time cases. We're going to have a comprehensive assessment. We decided there was a lot of discussion which went through about assessment. Considering its certification, we wanted to have both objective as well as case-based comprehension test. So we're going to have a 30 or OBT, that is the objective-based test, which are to be answered within 30 minutes with 4 options with single best answers. And we also have a case-based comprehension test where we're going to have a real-life scenario, which is going to put in and questions based on that. And we're going to have 3 questions, 10 minutes each. So the assessment is going to be for about 10 minutes. For about 1 hour. And the delegate has to score at least 75% to 35. And there is going to, after this, the delegate goes through what is called the interactive panel with global exposure based on clinical problem solving. So it doesn't end there. So if there are going to be real questions which need to be answered, they can be putting in, on a virtual one-to-one discussion with an Indian co-chair as well as a global co-chair. There are going to be periodic updates. And whom? We are going to look at teaching faculty, postgraduates, postdoctoral fellows from medical colleges, everyone who practices obstetrics and gynecologists. We want the members of the local obstetrics and gynecologic societies to liaise with us. We want to reach out to private obstetrics and gynecological practitioners as well. Now, what is the course plan? So we have an introductory foreword by the KOLs, Dr. Kamini Rao, Dr. Hema Devakar, as well as Dr. Ramamurthy to start off. Then we have the modules. So I just want to emphasize on these modules because a lot of effort has been taken in to get the best of who is who about hypertensive disorders in pregnancy in the country as well as across the globe. And we've thought about these topics with a lot of efforts. So the first is on introduction. So we have the definition, etiopathogenesis, classification of hypertensive disorders of pregnancy for about 30 minutes. The speaker is none other than this Dr. Sanjay Gupte, who's the Secretary General of World Justice Organization. And the concept builders who've contributed to this have been Dr. Sunita Mahesh and Dr. Sushma Madhuprakash, who are maternal fetal medicine consultants from Bengaluru and Mysuru, respectively. The second module of the second section of the first module is about maternal fetal surveillance. So after the definitions, we have the surveillance module where we have none other than Dr. Girija Wagh, who is the Vice President, Justice India Association, who's going to talk about this. And we have Dr. Chaitra, who's currently, part of this session, and she's the one who's actually giving the introduction. So she's contributed to it along with Dr. Hemavati Srinivasan, and both of them are maternal fetal medicine specialists from Bengaluru. Then the next module is about preeclampsia, the latest clinical updates. And this is going to be presented by Dr. Tarakeshwari, who's the medical director and head obstetric medicine unit from the Fernandez Hospital, Hyderabad. And supporting her as concept builders are Dr. Smita, who is a maternal fetal medicine consultant from Milan, Bengaluru, along with Dr. Srividya, who is also a maternal fetal medicine consultant from Bengaluru. Then the most important thing that we are facing right now in our country, the problems and challenges from the Indian perspective, is going to be presented by Dr. Alpesh Gandhi, who is the president of FOXI. And he's a specialist in critical care and obstetrics, high-risk pregnancy expert from Ahmedabad. And he is being supported by Dr. Chaitra Satyanarayana and Dr. Asha Kiran Rathod. Dr. Chaitra is from BGS Global Institution, Bengaluru, and she's the assistant professor there. And we have Dr. Asha Kiran, who's the assistant professor, Department of OBG, Bangalore Medical College, Bengaluru. Then the second module also has the management strategy in a low resource setting, very, very important from the Indian perspective. And we have Dr. Suchitra Pandit, who's going to be talking about it. And she's the president, Gestosis India Association. And supporting her is Dr. Srimati Raman, who is a consultant obstetrics and gynecology as a concept builder. And she's from Rangadure Memorial Hospital, Bengaluru. Then the next module, we finished 2 modules. The third module is about recent advances. So we're talking about the biomarkers, we're talking about the bias and PrEP. So we have prediction and prognostication of preeclampsia, role of biomarkers and other tools. So from the global perspective on the androgenic biomarkers, we have none other than Dr. Sarosh Rana, who is a section chief maternal fetal medicine. And of course, I mean, I don't really have to introduce her anymore. So she is the global chair of our project. And this is for about 30 minutes. Most of these talks are extending between 60 minutes to 150 minutes. So I'm not directly reading out exactly how much is each talk because I want to emphasize on the titles as well as the faculty. As part of the recent advances, we also have Professor Laura Maggie, who is the president of the International Society for the Study of Hypertension in Pregnancy, who is going to talk about the PICE and PrEP model. And this is for 30 minutes. Then, of course, from the Indian perspective, I would be talking, that's Dr. Revati, would be talking about the SBIT1 PLGF on the recent robust study, which was published on the role of biomarkers and how we can make a difference using the biomarkers for prediction and prognostication. Then, of course, we have another international faculty, Dr. Michael Gravitt from the University of Washington, USA, and he is going to be talking about glycosylated fibronectin, about a collaborative study that he's performed with the Indian counterparts. And he's Professor of Obstetrics and Gynecology, and as well as subject matter expert, Bill and Melinda Gates Foundation. And this is for 25 minutes. So we are exactly at the mid portion of our modules. So the 4th module is the very important clinical panel, and this is going to be driven by our president and, of course, the co-chair of the Indian co-chair of PENI, Dr. Prakash Mehta. So it's going to be looking after clinical challenges, management protocols and dilemmas, including strategies for averting complications, very important, and prevention preeclampsia with real cases. So we have faculty from across the country. We have Dr. Jyotsna Suri, who's Professor, Department of Obstetrics and Gynecology from VMMC and Safdarjung Hospital, New Delhi. We have Dr. Prarthana Shah from Aurangabad. She's a maternal fetal medicine consultant there. Then we have Dr. Charmila Ayavu, who is from Trichy. And we have Dr. Preeti Kumar, who is the chairperson of Safe Motherhood Committee, FOXI, at Lucknow. We also have our eminent faculty, Dr. Mrityunjay Bellad, who is the professor of Department of Obstetrics and Gynecology from KLE Medical Academy of Higher Education, JNMC, Belgaum. And we have Dr. Saswati Sanyal, all the way from Assam, who's contributing to the panel. She's Professor, Department of Obstetrics and Gynecology, Guwahati Medical College and Hospital. And the concept builders for the panel are Dr. Anu Joseph, Dr. Shruti K. Prasad, both are maternal fetal medicine consultants from Bengaluru, and they're also part of the SMFM team. We have Dr. Deepthi J. and Dr. Harni P. Shetty, maternal fetal medicine consultants from Bengaluru. And there ends the panel. The next important module is the cutting edge concepts, which is going to be the first part of it is going to be on first trimester screening for preeclampsia. And we have none other than Dr. Leona Poon, who's the professor, Department of Obstetrics and Gynecology, the Chinese University of Hong Kong, and the editor, Ultrasound in Obstetrics and Gynecology, who's going to talk about first trimester screening for preeclampsia, role of aspirin in prevention of preeclampsia. And this is going to be for 30 minutes. And then, of course, we have Dr. Rana coming in again, and she's talking about her study regarding postpartum hypertension and future cardiovascular risk, a very, very important talk, which we all have to, I mean, this is going to probably make a difference to the preeclamptic women after delivery. So this was briefly about all the modules. I'm so excited to be presenting. There was so much that went into getting in people together. We learned a lot about collaboration. We learned a lot about connection. And I'm just hoping that, we reach out to a lot more people and continuing this saga. Now, the next important module is the assessment module, and we have none other than Dr. Jyotika Desai, who is the past president of the Bangalore Society of Obstetrics and Gynecology, a senior consultant of obstetrics and gynecology from PR Desai Hospital. And she has also been a very supportive faculty for the Society for Maternal Fetal Medicine. So she has been coordinating the assessments, and the concept builders for the assessments have been for the OBT. We have Dr. Padmaja from who's the HOD of Department of Obstetrics and Gynecology from Doddaballapur, as well as Dr. Padmashri from Saptagiri Medical College, Bangalore. You will notice that we have faculty from medical colleges, from private hospitals, from research institutions. We wanted all of them together. And of course, for the clinical-based test, we have Dr. Aruna Muralidhar, who is the Senior Consultant of Obstetrics and Gynecology from Fortis La Femme, Bangalore. And we have, of course, Dr. Aparna Setia, who is a budding star and an MFM Fellow from Department of Obstetrics and Gynecology, Bhagwan Mahavir Jain Hospital, Bengaluru. So the registrants will be scheduled for, and after this, so once you pass your once you are successfully get the 75% score after the assessment, then you get into the live interactive session for 60 minutes with the co-chairs, that is including the global as well as Indian at the end of the course, which will provide them with an excellent opportunity to clarify real clinical challenges with the experts directly. We have a specific delegate course essentials list, which will tell you about the assessments in great detail. And we also acknowledge the educational grant from Roche Diagnostics India for this project. So I think I can go on and on, but I need to probably leave the stage for the rest of the faculty to talk. Thank you so much.
Thank you, Dr. Revati, for taking us through the contents of the crisp yet comprehensive PENAI course. I now request Dr. Smita to take over and continue with the proceedings of this program. Thank you.
Thank you, Dr. Chaitra, and definitely Dr. Revati, that was like a roller coaster ride. I think it's a dream come true for each one of us here. Vision precedes, purpose fuels, and hard work yields success. There cannot be a better example than this for PENAI Project India with visionaries like Professor Sarosh Rana, Prakash Mehta sir, and Dr. Revati. I think they've been the visionaries and they've been like beacon lights guiding us through every moment. And definitely with the hard work of the concept builders, and I'm sure it's bound to be a success. So without taking much more of your time, I would like to call upon our next speaker, Dr. Padmini Prasad. She is the president of BSOG Bangalore. Over to you, ma'am, to give your insights about the project. Dr. Padmini, ma'am,
unmute.
Can we have you?
Yes, sorry. Ellarigu namaskara. Good afternoon to you all. This is Dr. Padmini Prasad, President of Bangalore Society of Obstetrics and Gynecology. I take this opportunity to thank the organizers, the Society for Maternal Fetal Medicine India, with its co-chairs for PENAI, President Dr. Prakash K. Mehta and Secretary Dr. Revati Rajan, along with the International Society for the Study of Hypertension in Pregnancy, with its global co-chair for PENAI, Dr. Sarosh Rana, for extending this opportunity to be a part of this beautiful gathering today on the official launch of the Preeclampsia Education of the Nation, India, PENAI, as a commemorative initiative on the World Preeclampsia Day. PENAI course is a series of virtual modular comprehensive certification courses designed to empower clinicians across the country and beyond with the latest evidence-based guidelines and research on preeclampsia. Considering that preeclampsia has been attributed to 7 to 8% of maternal deaths in the country, I hope that this certification course navigates beyond the pilot, making a difference to the lives of all the pregnant women and their unborn across the country and beyond. Let us work together and save lives. I congratulate Dr. Prakash Mehta and team for this initiative of a great awareness and learning program. I also congratulate all the faculty. I wish the program a great success. Thank you very much.
Thank you so much, ma'am, for your inputs. I would, with pleasure, invite our next speaker, Dr. Jyotika Desai, Senior Consultant, Desai Hospital. And she's been, she's been a name synonymous with teaching during DNB days. I still remember, I've not grown out of my studentship. Over to you, ma'am.
Dr. Smita?
Yes, Dr. Sunita.
Yeah, actually, I will be starting the session.
Oh, yeah. Oh, I'm sorry. Yeah. Now we'll call upon Dr. Sunita Mahesh. She's been a colleague to us, a mentor, and she's right now the medical director of Milan JP Nagar branch. And over to you, Sunita, ma'am.
Yeah. Hello, everyone. I'm sure that you would have understood about our modules and about our course and the painstaking pathway which we have gone through to make sure that this course gets the biggest highlight and helps all the clinicians across India. And we are also planning to take it through the world, because preeclampsia, hypertensive disorders of pregnancy is such a complication, which I'm sure that everyone will agree that, once you face this complication, we are stuck with it, sometimes for days, months. And as Dr. Sarosh has already put it, it is going to be a lifelong pathway for the woman, the pregnant woman. So understanding all these complexities and the new research is always very challenging to all the obstetricians. Obstetricians are always stressed when we come across patients with preeclampsia, because it's a tightrope walk. We go through this trying to weigh the balance between the maternal morbidity and the iatrogenic prematurity, which we will create if we try to deliver these patients early. So with this Penai course, I'm sure that all of you will be able to understand this enigma through the various modules, which has been very well designed so that all these complexities get clarity and will help us in the goal of delivering a healthy mother with a healthy baby. India, being a highly populated country with diversities and low resources, need to have unique management strategies. And this is where Penai will pitch in. This will help us to have understanding on the recent advances, as well as the cutting edge concepts by the international speakers also, who are trying to help us in building this course. Interesting cases are also discussed. And finally, we conclude with the assessment of the registered delegates through brainstorming questionnaire, which instills a high level of confidence to deal with such complications. All the best, and thank you very much.
Thank you, Dr. Sunita. I'd now like Dr. Srimati Raman, Consultant Obs and Gyne, Rangadore Memorial Hospital, to talk a few words. Dr. Srimati?
Good afternoon, everybody. Good afternoon to all the faculty. Yeah, hello. Can you hear me?
Yes, Dr. Srimati, please go ahead.
Yeah. Good afternoon to all the esteemed faculty and the delegates who have joined us today for the launch of Penai. I congratulate Dr. Prakash Mehta and Dr. Revati and of course the whole Penai team for taking up this excellent initiative and doing this online certification course. COVID-19 has changed our lives completely, but it has also helped us discover, and embrace technology in various ways. I mean, without COVID-19, I think online learning, virtual conferences would have not become the order of the day. We would not have had the comfort of reaching a wide audience. we would not have had the comfort of knowing the learning which could happen from home. So maybe COVID-19 has helped us in this way. And as we all know, hypertensive disorders of pregnancy is a major problem faced by healthcare professionals throughout the world. This course is a compendium of all relevant information which is relevant to hypertensive disorders of pregnancy. There's been lots of exciting and extensive research, as was highlighted by Dr. Smita, which is going on in this field, right from etiopathogenesis to prediction, prevention, management, short-term, long-term complications, etc., etc. And it's important that we clinicians are constantly updating our knowledge so that we can give appropriate care to our pregnant women. So going on into this project, guidelines from various national and international bodies, meta-analysis, all the current evidences, they've all been synthesized and they have all been analyzed to arrive at the final content. And this has been checked for its accuracy and relevance. So this course should help in imparting a clear knowledge of the evidences and understanding of the disease. And it should also explain how this knowledge can be put into practice, how it can be adapted and adopted to our local and regional needs. So I wish this project a great success, and I hope that we are able to reach out far and wide so that we can improve the care given to our pregnant women. And we hope that we are able to decrease the maternal and the neonatal mortality, and also, decrease the short and long-term morbidity associated with preeclampsia. Thank you, everybody. And
thank you, Dr. Srimati. Now I would request Dr. Jyotika Desai to speak a few words about the PENAI project. She's been with us every moment of it. Over to you, ma'am.
Thank you, Smita. Good afternoon, friends. Successful people don't relax in chairs. They relax in work, they sleep in their dreams, and wake with commitment. These symbolic words by Hitler may well have been meant for all who have worked incessantly for PENAI, specifically Dr. Prakash Mehta, Dr. Revathi Rajan, Dr. Saroj Rana, and the busy as bees, the concept builders. Yes, my dear friends, PENAI is the need of the hour. We are aware of the havoc preeclampsia plays in the lives of our pregnant women, not to forget us. PENAI, as you have already heard from the previous speakers, will address the issue of a uniform code for prevention, prediction, hopefully with biomarkers, diagnosis and management of this enigmatic disorder all over India and elsewhere, so that we are all on the same page, speaking the same language, making data collection and analysis more meaningful, and also making a tangible difference in the lives of our pre-eclamptic women. At the close of the modules of learning comes the final module where your understanding and comprehension will be assessed by objective MCQ-style questions and real cases. Mind you, if you have attended all the modules, these self-assessment tests will be a veritable cakewalk. Looking back, it has been a wonderful experience being a part of this beehive of intense activity. And now we are all looking forward with excitement to the commencement of PENAI and its acceptance by a wide section of obstetricians all over. Thank you so much, and a very warm welcome to the exciting world of PENAI.
Thank you, ma'am. Thank you for your words, which were beyond inspiration.
Smita, 1 minute. We have a very senior obstetrician from South, Dr. Jayam Kannan. Dr. Jayam, if you can unmute yourself, or you want someone to unmute you. We need your blessings for the program. So please say a few words.
Is Dr. Jayam there? Has she gone? Or is she there still?
She's there. Chitrakala, can we unmute Dr. Jayam Kannan?
Yes, sir.
There she is.
Yeah, she's there.
Yes.
Yeah, madam. Without your blessings, we don't move ahead.
Thank you very much. I just had this message in my Trichy Society group at about 3:15. Then I immediately joined. Anywhere the word preeclampsia is given, there I am. That is how it goes. And I'm very happy. I've been following right from your talk till now. And I'm very happy to see that you are trying to educate all people in the best possible way. And I have heard Revathi doing a lot of work in preeclampsia. I think before they're saying meeting at Preeti Kumar place at Lucknow, we had a discussion. After that, we never had a chance to speak. And now I'm very happy to see all youngsters joining together, making this flag go high up and reduce the maternal mortality.
Madam, when you say youngsters, do you include
Thank you,
also?
Prakash. You must say thank you because she considers us also as youngsters.
That's what I said.
Considering my age, you are all very, very young, no?
You don't look
Thank
it
you.
there.
Thank you. Over to Jyotika.
And about any of our, lot of our faculty are here. Dr. Shashwati was there, Dr. Tarkeshwari was there. Anybody would like to speak, please? Dr. Shashwati?
Shashwati, unmute yourself. Unmute karo. She is there. I can see her. Yeah.
Unmute. Yeah. Okay, I'm really very, very happy to be a part of this, Benai. You know, this preeclampsia is a subject which is very, very close to my heart. And I was interested since I was a postgraduate student. And when Prakash told me that he wants to be in this particular group, I was so fast. I was so happy that I would be able to, because wherever I went in medical colleges and different postings, I tried to do something for this poor woman. And when I saw the people who are working in US, like Professor Sharosh Rana, he has so much of passion that he wants to do something for our India. It is really overwhelming for me. And the people working like people like Prakash Mehta, you know something every day, you also learn things. This is an interchange, and I'm really, really happy that this is going to be a nice things, not that old systems, and the new things people will know how to manage. And this is a fantastic program. I would say this is really going to be a very fantastic program. Thank you so much.
Thank you, sir.
Thank you, ma'am. And we have a few guests from abroad, of course, not excluding Dr. Sarosh. Dr. Sarosh is our own. We have from France, from Italy. Would anybody like to speak?
Prakash, Bellad is there.
I think from Italy, we have 2 or 3 people.
Yeah. Sir, Madam is telling about Dr. Bellad. Dr. Bellad.
Yeah, all faculty we'll have all. Okay, till they join. Dr. Bellad, are you there, please?
Yeah. Hi, Dr. Prakash, Dr. Revati, and Dr. Saro. See, I'm happy to associate with this program. I think you all have been well versed with our community level intervention for preeclampsia trial, which has brought, and day for yesterday, I was with Sarosh on the action on preeclampsia program at the UK, along with Dr. Andrew Seenan. And I will be happy and hope that the community aspects of the prevention of this preeclampsia, community education, community awareness, birth preparedness by the community, all these are important aspects. Of course, we are also doing the higher biomarker studies in our institute. My 2 of the postgraduates are doing on this. One is on glyphine, and the other one is on PLGF. And we are also looking at the SFIL to PLGF ratios. So this is an amazing platform for all of us. And our aim now, because see, all India maternal mortality ratio has come to 113 as for the 2016 to 18 SRS is concerned. The further bringing down is a real challenge unless we adopt the policies what this PENAI under the able leadership with Prakash Mehta and Saroj, which will be really a big thing, because we need to prevent preeclampsia if you want to further reduce the maternal mortality ratio. Our best wishes are with all this team, and I will definitely be happy to associate with this program, and any aspects, be it higher level of biomarker level research, or at the hospital based research, or at the community level research, or the community participation and prevention and education will be of immense help. And I will be happy to share all that experience what we are having. Prakash, it will be a really good collaboration and good coordination between the metro and the other lower level city, because that's where our India need to bring down the maternal mortality. It is that from the village level it has to start. So I will be very happy, and congratulations, and my all best wishes with this PNI program. Thank you, Prakash.
Thank you. Thank you. And I think we have Dr. Jyotsna Suri, one more of our faculty. Dr. Jyotsna?
Yes, hello. Hello, yeah.
Doctor. Unmute yourself.
Yeah. So thank you and a big congratulations to Dr. Prakash and Dr. Revati, Dr. Jyotika, and of course, Dr. Rana. So it's really a very, I never, when I, Dr. Prakash rang me up and asked me whether I would like to be associated because, I have seen over the years his passion for teaching and for, high risk pregnancy. It was like, obviously if he's doing something, it has to be very good and something which will be of great use to the society. So I immediately said yes. But today I am feeling, a real pride when my name is there with such eminent faculty. So thank you, Dr. Prakash, for involving me. And pre-eclampsia, eclampsia is something, working in a medical college, we see so many cases even today. And it's very unfortunate that some of them come so late and, in spite of the best of our efforts, we are not able to save them. So I think if something can be done to prevent or diagnose them at an early stage, or, I think the prevention is something which can actually change the scenario for today. So these are the things, the biomarkers and all, I think they will be something which will really can change over the next decade. What we are seeing today, the pre-eclampsia, something very good can happen with these kind of initiatives. I'm sure we'll carry forward this, something good. So thank you again.
Sir, I think one important point which Dr. Jayam Kannaman has brought in, sir, about patient education and counseling, that I think we should put it in the panel because that's very important, how to counsel our women.
I'll include that in the panel. One question I'll include on that.
Yes.
I
And
would agree with that. And I think, I know the brochure is already finalized, but if you guys allow me, I created this massive program for patient education here at the University of Chicago. So maybe I can give like a 15-20 minute like practical talk about what as physician. And I mean, you don't even have to be a physician leader, just as a physician with your knowledge. I think we can talk about a little bit about what we can do for patient education. And that has shown tremendous improvement, at least in the postpartum follow-up after the patients are going home, and just in terms of empowering our own patients. And there's tons of material that's actually available even online that you can literally order from online and hand it out to your patients. So I think I'll be happy to maybe even like a 20-minute talk so people can then take it back and use it at your own institutions. I'm happy to do that, and maybe we can modify it somewhere. Thank you.
It's a good idea.
Madam Jayam, thanks to you, we have come up with a little alteration now.
And for the benefit of,
yes. Should we take questions? Would anybody want to say anything more? Or will, if there are any questions, we need to answer them before we close.
No, quite a lot of queries are there about how to register.
Chitrakala, are the questions ready?
Yes, sir.
And for the benefit of the delegates, each talk will come with a take-home messages summary, which will be emailed as a Word document to the delegates. The module will be open only for about a week, so that you can actually look into the module at any time as per your convenience, but later it is going to disappear, just to make sure that you've learned everything from the module. And after the 6th module, when you've taken, after the 5th module, you finish the assessment, there comes the interactive session module. And suppose a candidate does not get the 75% mark and is not able to certify, we would again give the modules free of cost for the next 2 weeks, so that the topics can be played in for about 2 weeks, where the delegate again gets to read through the modules and take the test. And very unlikely that somebody cannot certify at this level. And if it doesn't happen, then the delegate has to re-register. This is briefly about how the course is going to run. So it's going to be about 6 weeks by the time you finish the course.
The passing marks are going to be, the certification marks are going to be 75%. And because the module is going to stay with the delegate for at least 2 weeks, they have enough time to go through the module as many times as they want. After that, it will self-destroy.
Yes.
We have another question, I think, from Khatib Farhin. What all guidelines will be covered during the course? They want to ask, sir. I mean, Dr. Revati or Prakash Mehta, sir.
Yeah, we are, whenever we are making the module, we have ensured that we take in all the important points of the various guidelines that are standardized into our program. As a matter of fact, when we were discussing our etiology and classification, we finally decided to come out with a proper chart of all the various guidelines, because each of the guidelines have got a little bit of difference in their classification. So we thought we put in all the guidelines together so that the person attending understands and then finally chooses, okay, this could be what could be the most practical.
So basically, it's about summarizing the best of all the classifications and trying to discuss what would be relevant to our population. That's the whole idea, what sir is trying to communicate.
And at the end of the program, we also have a feedback regarding the ISSHP guidelines that are there, and see what the delegates feel about them, so that we could pass it on back to the ISSHP, and if anything needs to be done about it, they could do.
Yeah, and I've been part of creating the ISSHP guidelines. So one of the things that we really wanted to do is to get feedback from the delegates about how they feel about the ISSHP guidelines, because we are actually, the latest 2021 guidelines are not out yet. So we are actually working on them. So it'll be nice to get the feedback about the guidelines themselves and see if we can incorporate any changes in the guidelines for the next round of guidelines. So yes, thank you.
I think there have been some questions regarding registration. So registration will start from June. So you will go through the official website of either the SMFMI or the Medinet, who is going to host it for us. And once you're registered, you will get access to the modules. And each module you will be able to access only for 1 week. You can look at it anytime during your convenient hours. But after 1 week, you will not be able to access the module. You'll also be sent a Word summary, that is a Word format summary of what the module has briefly. And only once you have completed all the 5 modules, you will be let in for the assessment. So you cannot just take one module and then write the assessment. So you have to go through all the 5 modules compulsorily. Anything else that we have to answer?
Yeah, there was one question whether Ayush doctors can join in. I think we need to discuss that policy and we'll let you know whether Ayush doctors can join the program. See, our aim is to bring down the maternal mortality and perinatal mortality. Whoever is willing to pitch in, they are happy with that. But since it involves a cross-pathy, we need to just discuss it in the committee once, and then we'll let you know.
Yeah.
Revati, there's a question.
Yes,
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 please
Dr.
go ahead.
Sarosh. There's a question there. It says, with the recording of the session shared with us, I don't know if that's this session or just in general, all those. So all those modules, will they be like, their video recordings, will they be shared with all delegates? Like once they're done, they can keep them for future use for education in their own institutions, or no?
No,
They'll get the modules only for a short period of time. They have to go through it properly, and after that, the module will self-destroy itself.
And we will be giving a summary, a Word format summary.
Giving a summary of it. And then they go through the assessment so that we are sure that they have understood what we are trying to tell them.
The whole idea is not to dilute the certification, because we don't want somebody to just look into one module and not take the assessment seriously, because it's about actually certifying people and care providers. And if the institution would want to liaise with us, I think they can do it at an institutional level and we can share it across. No, sir?
Yes, yes. Can we get recordings of the modules No, I don't. I think the recordings of the modules are all, meant only for the delegate, and that too only for 1 week. So it's unfortunately we cannot provide, but we are going to give you the summary of every module at the end if you're registered for the course. I think that should really help you. The idea is not to have a module with the delegates, but we want them to go through it, learn something, and put it into their practice. That was the idea, because otherwise all of us collect so many recordings and we don't even go through it most of the time. We didn't want that.
And Professor Mehta, that is like, and we can think in future, perhaps I'll put in a plug of maybe doing this yearly or every 2 years, but a lot of competency course, you can think of it as a competency course. So we do a lot of competency, everyone does competencies here. So it's annual thing. So you do it, it's not that you're going to take the recording home and start teaching other people. It's your own course. So you have to do it, you have to learn. Then yeah, you have to perform. I mean, most of these competencies actually have even a higher bar, like even 85, 90%, you have to actually get the course correct. So 75%, I think, answer correct is a pretty high and good bar. And then maybe we can think about it. Maybe we can update the courses with latest information, and we can have an annual competency, depends on how many delegates we get in the first round. But yeah, we could think through those things as well.
We wanted to
basically, this is still a pilot project. So we are also in the learning process. We will definitely modify as we move along, because our aim is ultimately to reach as many OBGYNs across the world as possible.
And in fact, there has been a feedback form which has been created with everything in mind, starting from the logistics, from the course content to the assessment. So we would take this very seriously and beyond the pilot. So we would incorporate all that beyond the pilot as well. And we are also welcome for organizations to reach out to us so that they can make sure that everyone takes the 5 modules correctly and then pass the certification rather than just giving it to individual people.
Yeah, there is one question on what is the duration of the course. It's not a fixed duration. You get your module for 1 week.
So the course ends at 6 weeks.
At the end of 6 weeks, possibly you would have finished everything. And it all depends on your pace of learning. You want to do it fast, you can do it fast. You want to do it a little bit slow-paced manner, you could do it.
But essentially, it's a 6-week course. Yeah.
Yeah, it's essentially it'll be a 6-week course, because the assessment test and the interaction with the chairpersons are a kind of a fixed timing. So ultimately, it will land up that much. One more question. I think we have already told that we will be giving a case summary, a summary of the entire module, so that you can read it whenever you want. And see, our aim is nothing else except that the maternal mortality and the perinatal mortality due to preeclampsia comes down more than the mortality, even the morbidity. So we are open to anything as long as this goal of improving maternal care is achieved.
So there's a question on where would you access the course. So once you're registered, you will get a link with respect to each and every module. This is essentially to the website, either the SMFM or the Medinet.
Yeah, I think the question
with a separate password
has been coming more often. Please remember that today is just the launch of the program. We are hoping to start the program from June onwards, and definitely on the Society for Maternal Fetal Medicine website and on the Medinet website. And of course, all those who have joined today, we are going to have your contact details, and we will be sending you some communication so that you can join the program.
And there's a question on, is there a limit for the registrants for the pilot? Yes, because this is the first time we're doing this. We want to make sure that everyone is like going through this through a proper certification course. I mean, so it's going to be like 50 delegates per course. So we have about 200 for the pilot, and we can start the course if we have 10 registrations. So we want to concentrate more on the feedbacks and how to make it more robust. So we're looking at limited registrations of 200 over 6 months.
Percentage needed to clear the assessment exam, it is going to be 75%. I know Dr. Sarosh said 85, but actually I felt 75 was a wee bit high. Actually, I was arguing for 70, but ultimately we stuck to 75%.
We started with 85.
I know. Yeah, you see, yeah. I mean, I feel like 85 is good, but I think 75 is good. I think if you get 75% of the content correct, I think that's a very good achievement.
No, our aim is that people learn. That is the
Yeah.
only, that is why those who do not clear their assessment exam in the first time, they get the entire modules to go through again free of charge.
For 2 weeks.
So that they go through the modules again and take up the exam again and get their score.
We just want to empower them.
That's to empower everybody. That's the aim. But somewhere along the way, we had to keep some checks so that people don't frivolously attend the course and leave it. So that's why all these restrictions.
So there's been another suggestion about, having another course for the Ayush doctors. Maybe that we will discuss and we will come back to all of you.
No, we have received two nice suggestions this time. One is for the Ayush doctors, another is for the general public. We will definitely try to do that as much as possible. And very soon, for that matter, we'll definitely do it. But I need to discuss in the committee, make sure everybody is agreeing to it, and then we go ahead. Because we have got another very big project coming in. That's a full book on hypertensive disorders of pregnancy. So we are planning to bring out a 45-chapter book for hypertensive disorders of pregnancy. Of course, we will be disturbing Dr. Sarosh for that. But we are planning to bring out that entire book as soon as, once we settle down with Penai.
Yeah, I think we will have the vote of thanks.
I think the questions have stopped coming in, and each one of us can definitely make a difference. Together, we can make a change. I request all our delegates and participants today to join hands with Penai India to bring about this change. So on behalf of the Society of Maternal Fetal Medicine India and Team Penai, I would like to thank Dr. Sarosh Rana, the Global Chair, without whose guidance and support and I think vision, none of us could have gone forward. And the Indian chairs, definitely Dr. Prakash Mehta and Dr. Revati, who have been mentoring and guiding at every stage. And another big vote of thanks to University of Chicago and for all the teams that are involved with Professor Sarosh Rana there, who have been helpful in these achievements. And ISSHP definitely, who's been pivotal in giving this platform for Penai project. Roche Diagnostics Private India Limited for all their support in terms of funding and providing the logistics. Medinet for knowledge and hosting partners for our platform. Shield Healthcare for enabling this wonderful session today. And definitely thanks to one and all, and hope our dreams and visions come true.
Yeah, Smita didn't talk about concept builders because she herself is a concept builder, but I have to thank our entire faculty. I repeat again, each of the faculty from across the India just needed one call from me to accept to be on the program. I'm really happy to say that, and I'm very happy that all of them, all of them are very, very busy practitioners, Dr. Sarosh. They're all big names in their own states or even across the country, but they have been here with us from last 1 hour. Most of them have stayed with us. Most of them agreed to be on the program. And I'm really thankful to all our faculty who took part and who is taking part rather. And I would also like to thank all our concept builders, the young dynamic team without which, we should see their WhatsApp correspondence going on in the group. I was really touched. This project has been in my mind for the last 15 years. I remember Revati coming to me as a student and we were discussing cases of preeclampsia. And I would always tell her that we should have this kind of a program. And I think at the end of 15 years, now it's becoming a reality. So thank you all very much for being with us.
Thank you, Prakash.
Thank you, doctors.
So thank you so much, Dr. Sarosh. Thank you, all of you.
Thank you.
Thank you, Shield. Thank you, everyone.
Thank you, Dr. Sarosh, for staying till the end.
Absolutely.
Thank you, doctors.
Thank you, of course.
Thank you so much.
Lastly, on behalf of Shield Healthcare, I would like to express our sincere gratitude to all the speakers and the attendees in today's program. It is a great initiative, great launch, and we wish for a grand success for this program. Thank you, doctors.
Thank you so much,
Thank you.
Shield. They've given us a great platform. They've also done the YouTube launch of this. So I think thank you so much for all the strategies that you did to help us, spread far and wide. Thank you so much.
Thank you. Thank you.
God bless everyone and our mothers and their babies, and everybody please stay safe.
Sure.
Thank you.
Right, Prakash.